specific. They're not going to affect all of these. They're not going to affect all of these things over here, but at least I know kind of how they're working. You can think through it. If I tell you it's an anti-adrenergic, you're going to know it's working against the adrenergic side and pushing us over to this side. Does that make sense? Okay. Whereas, as I was thinking ahead of myself here, parasympatholytic, cholinergic, antagonist, and anticholinergic, they produce oftentimes these symptoms on this side. Okay? All right. So I can think of a very specific anticholinergic drug. It's atropine. So if somebody is, many of you know atropine. How many of you work in nursing homes? Have you ever put on a little atropine patch? What's that?
What type is that? The atropine.
So atropine is one of these anticholinergics. Okay. A lot of times, if somebody is in somebody's in hospice, we'll put it on. We'll put it on a patch, right? We take the one patch off before we put on the other, right? But we put on a patch. What are we using it for at that point? Stop secretions. It's anticholinergic. So we're stopping this and pushing it that way. Okay? Does that make sense? Real easy way to think of it. It's not very systemic if we're just using it as a patch right next to the mucous membranes right here, right? Well, we can also give atropine. It's still an anticholinergic, right? We can also give atropine for somebody who is symptomatic and bradycardic. Okay, we oftentimes don't go ahead and give it to somebody who is asymptomatic and bradycardic, but somebody who is bradycardic and showing significant symptoms, we're going to give it. And so it pushes, it's very systemic, and it pushes everything over this way. A person who is getting atropine now is they're monitored, right? So I want you to think like a nurse. I'm going to ask you a question about it. They're unstable, okay? So select all that apply. Which one of these things am I going to do as a nurse? Collaborate with the MD and insert a Foley. Collaborate with the MD to increase heart rate. We'll take that one out because we just did that and that's a confusing one. But collaborate with the MD to give a Foley. Make sure the patient has plenty of water to drink to combat dry mouth. And go ahead and give oral Colace to so that the person doesn't get constipated. Am I going to do all of those? Person's unstable. Person's unstable. Okay, not the Colace one. Okay, I could actually they're unstable, and I would collaborate with the MD and probably put in a Foley. I would not give anything orally. Okay, if they're unstable, they've been symptomatic with bradycardia. They're unstable. oral things are not good for unstable people. They can aspirate pretty easily. The colace is not that important. The water, the pushing fluids is not a good idea. They're going to have to tolerate the dry mouth, but we can insert a Foley so that they're not retaining urine and feeling like they need to pee and they can't, and so they're trying to get out of bed when they're unstable, right? I mean, so it's really hard to think like that before you've actually worked in it, but we want to get you there, okay? Because we want to be your coaches, we want to be your cheerleaders, we want to get you there, okay? So now I've got, I'm going to try to make you think like a nurse, okay? So I'm going to give albuterol, okay? All right? Albuterol's ordered, PRN. Let's start with the nursing process. What do I need to do first? Assess, right? That's always my first step of the nursing process, right? Assess, assess, assess. What am I assessing? Somebody say heart rate and lung sounds? Absolutely. So I'm assessing what I can assess about how open those airways are because I'm listening to lung sounds. And I also know it's going to impact the heart rate, okay? Albuterol doesn't so much impact these things down here. It doesn't really get that systemic, but it does. It affects that heart that's sitting right there next to the lungs mechanically, just sitting right there next to it, right? So it's going to affect that. So those are two things I really want to assess before I give it, right? So if the patient is wheezing and their heart rate is 85, I'll go ahead and what's my next step in the nursing process? What am I starting to do already? Analyzing it. Okay. Now, what's the next part? Plan, right? I'm going to plan to give it. Should I give it? Should I not? This is part of my decision-making process. I'm planning, right? I'm thinking about what I want my goals to be. I want the patient to be able to have decreased wheezing, right? Absolutely. So I'm going to go ahead and I'm going to plan to give that intervene. I'm going to actually give it. What's the ending of the nursing process? Evaluation, right? So I'm going to have to evaluate the patient afterwards, right? How am I going to evaluate? Go back, listen to lung sounds, right? Right? If that evaluation comes back that their airways have cleared, that's great, right? If it's a little kid who's come in, I go back in, I listen to their lung sounds. The airways have not cleared. I go back and I loop back to the very top there, and now this is my assessment for starting up the nursing process again, right?